Thank you very much, Rhonda. Now that we have Alexandre telling us about clinical engineering and told us about the nursing and clinical engineering, and Rhonda talked about respiratory therapist and clinical engineering, it's naturally that we're going to look around and say, where are the lab people? So we are delighted to have Jennifer Daley here today with us, Director of Laboratory Services in a place that, if you believe it, it's northern than Iceland, northern than Alaska. It's in the northern Western Territory of Canada, where she told me the temperature today is minus 40 degrees. Can you believe that? We are delighted to warm you up and have a warm welcome to Jennifer Daley that will talk to us about collaboration with the laboratory services and laboratory equipment. Jennifer?
Great, thank you, Yaron. And you gave me a promotion I don't think I earned. I'm actually the manager for lab services for Stanton Territorial Hospital, which is the territorial hospital in Yellowknife and serves the population of the Northwest Territories. So today I'm going to talk about allied health collaboration. And this is actually a collaboration between clinical engineers, which we affectionately refer to as biomedical engineers in Canada, diagnostic imaging, and lab services across the Northwest Territories. Next slide, please. So as I said, today we're going to talk a little bit about the Northwest Territories. We'll talk a little bit about the geography and some of the challenges that are part of that, collaboration between clinical engineers and lab and diagnostic imaging, as well as future opportunities, visions, and ideas. Next slide, please. So as Yaron explained, we are quite north. The area in the red circle here is actually the Northwest Territories, which is a territory in Canada. Canada has 11 provinces and territories. 3 of them are territories, and the Northwest Territories is right in the center. We have a very large geographic area that we are responsible for. As the slide states, it's 1.3 million square kilometers. We serve 33 communities, which includes 2 hospitals, 20 health centers, and 8 health cabins. We also have 11 official languages. Next slide, please. So in 2016, the Northwest Territories engaged in a monumental consolidation of services, which allowed for the consolidation of 8 separate health authorities. The advantage to this consolidation actually allowed us to have better standardization and to leverage the existing staff. So rather than replicate work that was being done independently, we allowed for expertise to be centralized and then more efficiently shared with each of our health centers. So as the slide states, this did allow for standardization of lab equipment, but also for consolidation of diagnostic imaging services and equipment. So biomedical engineering or clinical engineers were very helpful to us by applying that learned eye to many of our contracts. One of the advantages as a manager for lab, and this may be something that is inherent in many of your own countries as well, is that in health, we generally tend to promote from within. So we'll hire medical lab technologists and advance them through the management ranks. But the disadvantage to that is that we don't necessarily have all of the knowledge when it comes to managing our contracts. I certainly am not a legal expertise, and I certainly don't have a lot of legal contract experience. So it is helpful to have somebody in our biomedical engineering services who is able to look at our service contracts, make sure that we're getting money, value for our money spent, and also to hold our vendors accountable in ways that perhaps the managers of our services might not be familiar with. Next slide, please. So one of the other advantages to the consolidation was capital equipment is now being better tracked through a web application. This was implemented by our territorial manager for biomedical engineering, and this will help to identify planned replacements in a much more timely fashion. We always had evergreening programs across the Northwest Territories to replace equipment well before end of life or to prevent catastrophic failures, but it was operating independently at each of the sites and wasn't necessarily as efficient. So we would find situations where we would have catastrophic failures or equipment that was well overdue for replacement that was still in service, and we needed to make sure that we were planning our funding appropriately. Further to this, biomedical engineering or clinical engineers have maintained a close relationship with our territorial procurement team, which incidentally also has many clinical engineers on it. So this allows us to have a much more knowledgeable approach when we're looking to purchase equipment beyond simply what the opinions of the frontline users are. Frontline users, of course, are a very important part of the puzzle when it comes to their preference for equipment. But there are some things about biomedical engineers or clinical engineers that they bring to the table when it comes to things like service contracts, reparation, or repairing the instruments. If there's anything that they can do, oftentimes we can look at having them be the first call for repairing when certain vendors will allow that. Next slide, please. So one of the other significant advantages to having our biomedical engineering team so involved with our allied health operations is, again, the standardization of equipment. And this was actually successfully achieved recently across the Northwest Territories. So all of the health centers that have imaging equipment, as well as the hospitals, are now on standardized equipment. The biomedical engineering team maintain the inventory of all equipment, again, with the eye to standard replacements, economies of scale with respect to service contracts, as well as economies of scale with procurement. And then, of course, there's the continued building of relationships with vendors. And I cannot underscore how important this piece is. When your vendors are happy with the relationship that they have with you, they are absolutely willing to help you out when you're in a pinch. And with the biomedical engineering team, we have had that opportunity to have that first call for assistance. And in many cases, our vendors have been very amenable to allowing our biomedical engineers to receive factory training so that they can provide service and minor repairs. As you saw in one of my earlier slides, we're incredibly remote, so it isn't easy for our field service engineers from our vendors to fly up here to provide service or repairs to our equipment. So having that first call be in-house can lead to much more timely assistance and reduce the amount of downtime we may experience. Next slide, please. Another advantage to the diagnostic imaging collaboration was a consolidation of a medical physicist contract. Again, this allows for a coordinated approach to a service that is required all across the Northwest Territories and allows us to improve costs by minimizing the cost of travel by having the medical physicists come up and then visit all of the sites that require attention. And then there was also a significant improvement in the safety of the lead apron testing that was taking place across the communities. And that was a direct collaboration between the diagnostic imaging technical supervisor and biomedical engineering. Next slide, please. So in the future, our territorial manager for biomedical engineering will be looking at continuing to consolidate service contracts across the Northwest Territories, where possible, taking service in-house or being first call with the resources. They will assist Allied Health, so myself as the manager for lab services and my colleague, the manager for diagnostic imaging, with maintaining the vendor contracts and again, consolidating those contracts to achieve economies of scale. And they'll also continue to partner with other jurisdictions. Because we are such a small territory, we only have a population of approximately 45,000. We cannot potentially provide every single health service that could be required. And so we do have many relationships with other jurisdictions, such as other province governments. As indicated on the slide, Alberta is another province in Canada. And we also have a number of biomedical engineering technologists across centered in Yellowknife that have achieved additional training from original equipment manufacturers. And next slide, please. And that is all. Thank you very much, everybody, for inviting me to speak this morning.